Hi everyone, I'm the CEO of mediVR Incorporated, Masahiko Hara, and today I would like to make a presentation entitled Somato-cognitive coordination therapy using VR for advanced severe Parkinson disease. This presentation slide is for the second presentation at the Late Breaking Symposium of the 56th annual meeting of the Japanese Neurological Society. In relation to my presentation, I disclosed the following potential COI. Actually, I'm the CEO of mediVR Incorporated and it has stock ownership of it. Let me start with some backgrounds. As you know well, advanced severe Parkinson disease (PD), classified as Hoehn-Yahr severity classification stage 4 or 5 disease, is particularly debilitating. It often leads to severe gait and upper limb dysfunction, substantially diminishing the patient's quality of life. In contrast, recent technological advancements have led to the exploration of additional rehabilitation approaches, including virtual reality, VR, especially the therapy known as Somato-cognitive coordination therapy, SCCT, aimed at improving motor coordination disorders, is attracting attention from physicians across various neurological diseases. So I would like to explain about the SCCT. As you can see on the left side of the panel, this is the Penfield homunculus, which is a classical map of a primary motor cortex. And in 2023, last year, Gordon et al. Reported the presence of Somato-cognitive action network, SCCT, in the primary motor cortex, which is responsible for the coordinated movement in a whole body, as described as the marionette puppet placed between foot and hand, or a hand and mouse. They call it integrate isolate model, and this findings was from the functional MRI analysis. In our conceptualization, we think that the abnormalities in the SCCT can be described as the entangled strings of a marionette puppet. If you want to try to reach your left hand, patients could not reach their left hand. I mean, both legs or right hand simultaneously move as well in this kind of situation. And we think that SCCT is a treatment that visualizes and unravels the tangle of the SCCT and provides intervention to untangle it. So I'll show you a case because SCCT is applicable to a variety of neurological disorders, including Parkinson's disease as well as cerebral ataxia. This woman is in her 30s, 10 months after cerebral infarction, has ataxic symptoms of her right hand. And after only one 20 minutes SCCT session, the ataxic symptom improved too much, and the box and block test improved from 28 to 40. So SCCT is applicable to a variety of neurological disorders. So let's move back to today's topic, Parkinson's disease. The objective of the present study was to investigate the feasibility of SCCT in patients with severe Parkinson's disease. The study design was the singular multi-center prospective interventional design, and we included 20 patients with Hoehn-Yahr stage 4 or 5 disease at 3 institutions. The intervention included SCCT using mediVR KAGURA, which is a medical device registered to FDA or PMDA in Japan. And this is a specific medical device for use in SCCT. It's specialized for SCCT therapy. And patients were instructed to reach alternately in a sitting position. This is the way to give patients with SCCT in patients with Parkinson disease, and we gave patients with 20 minutes per session thrice weekly for 3 months, amounting to approximately 12 hours of intervention. And we set the primary endpoints as the safety, defined as the absence of adverse events, and the tolerability, defined as the ability to complete the prescribed therapy session without discontinuation. We also set the secondary endpoint as timed up and go test for gait function, simple test for evaluating hand function, UPDRS Part 3, and functional independence measure FIM. And through seated exercise, SCCT mimics walking, so we reported that SCCT seated exercise can improve walking ability. You can refer to this figure. And we employed parametric statistical analysis, so I will present the data as mean plus minus standard deviation in the present study and compared and evaluated the statistical significance using PRT test. Our study was registered to human CDR. And these are patient characteristics. 17 patients complete the 3-month trial successfully. 3 dropped out owing to relocation and health complications such as pneumonia, but all patients completed the study without discontinuation related to the VR intervention. Mean age was 76 plus minus 9, and 64.7% were male. Duration from diagnosis was 11 years plus minus 6, and 13 patients were stage 4 and 4 patients were stage 5 diseases. All patients received the combination of levodopa plus decarboxylase inhibitor, and the levodopa equivalent dose was 512 plus minus 238 milligram. No patients received device-aided therapy. And when it comes to endpoints, first, there were no statistically significant changes in medication usage. For example, levodopa equivalent dose from 512 at baseline to 518 at 3 months. And regarding the primary endpoints, safety and tolerability were 100%. There were no adverse events like falling or VR sickness, and all patients completed the prescribed therapy session. When it comes to the secondary endpoints, even though there were no significant differences in MDS UPDRS Part 3 or FIM, timed up and go test for gait function reduced by 8.9 seconds, as you can see on the left side, and step for hand function, as you can see here, improved by 9.6 points. Both are statistically significant with p equals 0.015 and 0.046 respectively. So let me discuss the concepts of mediVR KAGURA guided somato-cognitive coordination therapy. Actually, we have been aware of the abnormalities in scan since 2016, 7 years before the publication of this manuscript. And through our experiences, we thought that entangled skin can be provoked and improved in the specific environments, which consisted of 3 important parts. And these concepts were backed by 18 patented technologies. The first important point is invisible body part. So we do not use avatar like other VR software. And so because we need invisible body part, augmented reality or mixed reality technology could not produce this environment. VR technology is mandatory for SCCT, in my opinion. And the second important point was point estimation, which means aligning a controller with a specific coordinate. And giving these two specific environments to the patients, we can stimulate deep muscles. And these findings will be published in Journal of Physical Therapy Science in near future. And after managing or setting these two specific environments to the patients, we can give multi-sensory feedback to the patients. Then these aspects greatly enhance the brain's plasticity and resulted in improvements in many coordinated movements in the whole body. So as we show, we demonstrate that walking ability and hand function simultaneously improved through single SCCT approaches. Because SCCT targets the scan, which is responsible for coordinate movements, only single approach can result in walking and hand function simultaneously. And even though we did not present a speech function in this paper, the simultaneous improvements of speech function will be presented at the poster session tomorrow. So the important thing is single SCCT approach can result in the improvements of the movements of the whole body, such as walking and hand function and speech function. In conclusion, SCCT emerges as feasible and well-tolerated intervention in advanced severe PD. And even though this study is a feasible study and do not set the control group, so we could not give you a conclusive statement about the therapeutic effects, but it also has the potential to improve gait and upper limb function in these patients. Of course, due to a preliminary nature of the study, randomized controlled trial with larger sample size is required to validate and augment our study's findings, and this paper will be published in Journal of Parkinson Disease in near future. And for more information regarding SCCT, you can visit our YouTube channel. For example, you can watch the London Seminar 20 entitled The Impact of Virtual Reality Guided Somato-cognitive Coordination Therapy on Treatment of Neurological Disorders, the Transformative Role of Neurologists, at the 65th annual meeting of the Japanese Neurological Society. Thank you very much for your attention.